There are a number of advantages to having your treatment in oral form, but what makes it easy in that it is a pill and you can take it at home can also make it hard in that now the responsibility on taking their treatment is in the patient's hands. Oftentimes these aren't one pill every day, they're multiple pills, different times during the day. Sometimes it's 1 week on, 1 week off. 2 weeks on, 1 week off. It's a complicated schedule, and that's a lot of responsibility to have as a patient when you have a lot of other things going on in both your life. You may have other comorbidities or other medical problems that you're also dealing with. And so having that responsibility can be difficult. It is critical to take the medications as scheduled. Adherence is very critical. Response to the treatment is based on receiving the treatment that you should receive. And if you miss doses, you're not receiving the full treatment. And we really want patients to receive the full treatment to get the best response. That's where we should all work together because the patients are taking this at home. They should work with their family members or a friend who maybe will be able to help them at home, work with their nurse or their oncologist to really talk about what to do at home and how to take the pill so that it does work into their schedule. Because sometimes some of the pills have to be taken on an empty stomach, sometimes they have to be taken after a meal, and you should really think through, from start to finish a day, how you will fit this into your schedule. So if you've never eaten breakfast before, but now you have to take this pill every morning after, 30 minutes after you've eaten, you're going to need to think through how are you going to rearrange your schedule to fit that in. And it may sound simple, we'll just eat breakfast, but as many of us know, changing even a little routine in our lives like that can be difficult. So I think it's most important to talk through with your nurse or your oncologist sort of how a typical day will run and how you'll fit this treatment into your day since you will be taking it at home. There are a lot of ways that we can improve adherence to oral chemotherapy, and there's a lot that we have to do on our side as the providers. For years and years, we treated cancer with IV chemotherapy, and that's kind of what we did well, and we had policies, procedures in place to do that. But now that's all shifting, so we as healthcare professionals need to look at our practices and see, since we're moving really from mostly IV to a mix of IV and oral, how do we change our practices to match that? So a lot of hospitals are trying different things. Some hospitals have an oral chemotherapy nurse who really takes care of all of the patients who are receiving oral chemotherapy to make sure they know what they're receiving, that they're taking it okay at home, even that they get it filled and receive the pills at home, because sometimes, or very oftentimes, these are sent from a specialty pharmacy, so they're not pills that you can get from your hospital pharmacy. So the nurses help to coordinate all of that. Other hospitals are thinking about having an oral chemo clinic, just like we have IV infusion centers for chemotherapy, sort of having a clinic for patients on oral therapies to get the education and the support and the follow-up that they need. So I think a lot of it is on our end as providers. We need to think about how we can practice differently to match this change in cancer treatment. For patients who are on clinical trials, they usually are monitored very closely. So if their clinical trial involves an oral chemotherapy agent, oftentimes they have a calendar or a diary to complete that's part of the trial, and they get close follow-up because of that. And their adherence is monitored as part of the trial because we want to know if the trial is proven effective that the patients were taking the dose that was prescribed, so that we would know that going forward. And we should take some of those procedures in place for patients who aren't on a clinical trial, sort of the diaries and that follow-up, to make sure that all patients who are getting an oral treatment have that same close follow-up from their healthcare professionals. I would just encourage patients to be their own advocate and to really reach out if they have questions or if they feel a little anxious or uncertain about something. I guess when I think about what patients should know regarding adherence to oral chemotherapy, it's that they're really a partner in all of this, that they should be asking questions, bringing their family into this for support, staying very close with their healthcare provider so that they know exactly what their treatment is and why they're taking it, what the schedule is, what the side effects are, that they're really a partner in all of this, because now they're taking their own treatment, whereas before it was administered by nurses or physicians. And so to just be a very active participant in that, if there's something they don't understand or something that they're a little unsure about, to reach out and get those questions answered. So when patients are taking their oral chemotherapy at home, they don't have to come in to see their nurse or their physician as often. And there's some good things about that. It can save you, hours of time driving back and forth and parking and all of that. But there's some downsides to it as well. You don't have that time to build that relationship, and that's something that I think we're struggling with as nurses, because a lot of times when patients were in getting their IV chemo, they would be there for a few hours or longer, and we would get to have time to sit down and talk to them and find out how they were doing and meet their family and really build that relationship. Make sure they have a plan when they go home, when they are started on an oral chemotherapy agent, as to how they're going to fit this into their daily life. Even very specific questions, like if they are planning to be away, can they take enough of the medication with them, or if they're planning to just be out for the evening and they have to take it after a meal, how are they going to remember to throw it in their purse or in their pocket with them? And very specific questions like that, but just to really understand that they're part of this now, and they're part of the team, and they need to develop those relationships with their nurses and their healthcare providers so that they're able to get all of their questions answered and feel comfortable knowing what their treatment is.